My name is Sebastian. I'm partner with Acton Capital. It's a Munich-based venture capital fund, and surprise, we invest beyond others in health tech companies. We heard before that costs in healthcare are exploding. In large countries like Germany and France, those can exceed easily 10% of GDP. So every year in each country is about 300 to 400 billion euro being spent. And that obviously is accelerated with an aging population and more discovery of new advanced therapies. So digital innovation may help to reduce cost and at the same time improve patient care. But digitization in healthcare lags behind in Europe, especially in the larger countries. There was a study conducted by the European Court of Auditors on the maturity of online health services. And in this study, Germany and France actually ranked in the lower tier, way below average. On top, estimate guesses, who's the best in innovation and health tech in Europe? What do you think? Which country is ranked first? Yeah, the Netherlands is actually quite wide open, but the best ones are actually, as always, the Baltics and the Nordics. So Finland and Estonia leading the pack. Typically, digital innovation is driven by small and agile startups, but in health tech, there are some characteristics that make it quite difficult for startups to succeed and to find a business model. So first of all, the system is very inhomogeneous, not only across countries, but even within countries. In Germany alone, we have more than 90 statutory healthcare insurances, so a very fragmented space. There's a lot of regulation, there's a lot of compliance issues. Patient data is fragmented, so if you want to train AI models on patient data, it's difficult to get access for good reasons, obviously, as well, but nevertheless, prohibiting to innovate very fast. We had upstairs the speech as well on trying to get data early on in the journey of a process, way before actually symptoms come out. And IT systems are just not connected. There's a lack of interoperability. So it's a high complexity and risk environment for setting up a companies, and that obviously is disencouraging both entrepreneurs and as well us as investors. So in this panel, we want to discuss about, what are ways to change that? What are ways to get more startups into the system and get innovation moving forward? And happy to introduce again the panel. We have Roland, as Alessia said, CEO of BARMER, second largest statutory health insurance company in Germany, more than 8 million members. And Yannick, a founder, the brave one, who actually did found his company, Viatolea, despite all the difficulties, to add in a bit like the entrepreneur perspective. Unfortunately, our third panelist, she had to cancel on short notice. She was supposed to come from Paris, but due to health reasons, she couldn't make it. So I will try to hopefully add in a bit international perspective as well. But welcome. Maybe let me start with Roland. Just please introduce yourself briefly, and especially what is your view and BARMER's view on the digital innovation space?
Yeah, thank you very much, Sebastian, for introducing. Very warm welcome from me. As you heard, I'm Roland, CIO at BARMER. I'm in this role since 2022, but I'm in statutory health insurance for a long time, since 2003. And since 2019, there was a big change in the German health insurance system with the laws. Jens Spahn made laws who made the statutory health insurers to make digitalization of the health insurance system happen. And it was for me a very important point. And since then, I began my journey and was there with very interesting projects to electronic health patient records. And we started very big programs at BARMER. And I'm proud today we have a very bright ecosystem. And we want to change our role as pure payer to an innovator and to sharpen all the healthcare in Germany. And so we are three levers. I think we invest. We was the first statutory health insurance who had a venture capital investment, early bird in 2016, and it wasn't allowed by law, but now it is, and it's good that it's allowed, and that's the first first thing we do. And the second is to partner with startups like Viatolea and to support to make some great healthcare providing products. And the last is our own ecosystem with eCare, our electronic patient record as back end for this change of the health insurance system in Germany. And so that's my mission, and I'm there for IT and for aligning business with IT, because I think it's only a thing we can do together and to come to the front.
Yannick, as we heard, you are partnering with BARMER, you're cooperating, but before jumping into that, maybe introduce yourself briefly and of course explain what Viatolea is actually doing and offering for patients.
Yes, sure. Thanks for having me. So Viatolea is helping patients to detect and treat food intolerances. So we do this with a smart food and symptom diary that we detect correlations on. So this is a very efficient way, so we can lower the cost of the detection of food intolerances, but we also have a very individualized pathway where we help the patients to change their diet with the help of our nutritional experts. So we try to keep the balance between automation, but also personal contact, which I think is a thing that we'll be facing in the future of the modernization of healthcare system. I've co-founded the company 2024 together with my co-founder Pauline. She has a personal background in this area, so I do have a background in IT and economics, and so up until last year we were still developing the app on our own, and now we're a team of about 7 people. Very happy to partner with BARMER as the largest and one of the first customers.
So obviously for building such a company, so you're still relatively small, but now you need to hire people and pre-invest. You need to get funding, and it's never easy for startups. But especially in health, it's even more difficult. Like I'm a venture investor myself, and if somebody says to me, you want to invest in a company that works in a very complex regulatory framework, it's uncertain how to get funded, uncertain where to make the money eventually. You're actually dependent on public decision making, which you cannot influence. And scaling international is almost impossible. That would set off all alarm bells within me. So it's not actually an environment where I say, great, let's just put money into, because there's so many uncertainties. So how did you get financed, and what were the challenges that you had to overcome, and what, from your perspective, would be desirable to change that financing innovation like yours is getting easier?
Yeah. So we're bootstrapped in combination with public funding. So we do not have a external external capital with this. But this is very hard, especially in that field. So we're a certified medical device, and I think for most of for most startups, it's very hard to come over that hurdle. Yeah? Because it's a kind of like a circulo virtuoso. So you can't partner up with health insurances if you're not a medical device, but you can't get the funding to become a medical device if you cannot prove that health insurances are interested in your product. Yeah? So so we passed that because we lived and we started off in a very innovative medical ecosystem. So in Nuremberg, Erlangen, we got great support from, for example, Marco Wendel from the Medical Valley. He's here today, and the ecosystem helped us to make good momentum on that certification, for example. Especially in Bavaria, we're in the lucky position that we do have some great public funding programs, like, for example, the Medical Valley Award, that helps to bring startups from that experimental prototype stage to more towards, okay, I do have a product on the market, and to pass that valley of death. So that you get the first revenues, and then access to funding is a lot easier. Yeah.
To what extent do you cooperate within the startup scene? Like, is it more competitive, or is it more working together with others to build on their experience?
It is a lot of working together because you have similar hurdles that you try to tackle, and in that field, because you're mostly targeting different indications, you're not of that a competitor of that. Yeah. But when we come to speak about selective contracts, they are partnering up with health insurances. In this field, we're all competitors because there are only 95 health insurances, and there are only 1 to 2 contract managers, and every one of these health startups is pooling around these 95 people that live there in Germany. Yeah? So in that sense, we're not good friends, but in all other aspects, we're good friends.
So I assume, Roland, you're a busy person getting approached by many, many companies. You mentioned the 3 pillars you have that you work with innovation. Maybe you can go a bit deeper and tell, like, how does cooperation look like? What are you able to offer a company like Viatolea to help them strive?
I think it's important to start at the right point and to get connected. And as Yannick told, it's difficult if there are many great ideas and every startup wants to pitch it, and we have a very many pitches and many good ideas, and how to find the right idea to support and to look what's matching with our objectives and then we in our patient journeys or in our passes for providing better health care. And so it's like a memory or like a puzzle to find the right piece and the right idea and maybe a first prototype or product, and to get the next step to talk about how can we combine it with our own patient journeys, with our own healthcare passes, and how to support and help to find the right way and find the right contracts, like selective contracts. I think that's a great opportunity to start small and to start fast and to find a partnering with a win-win situation, because of our perspective for the health insurance, for the BARMER, it's important to have the right portfolio, the right product. And for the startups, I think it's important to have a partner who can help scaling, to help marketing. And it's very easy in our situation. On the website of Viatolea, you can see if you are BARMER insured, you can register, make a check, and then we will pay this product. And it's easier as find a regulation, highly regulated, like DIGA. We will talk about DIGA, I think, a bit. That's very good, but it's difficult to reach this position and to start with such a complex product, and so I think we try to support in a very early stage and give our knowledge how to make it and make some first easy finance like selective contracts which can offer this. And so we have a process to make all these ideas, and so I think it's a very good thing startups can find at our website how to pitch it, so it comes in the right channels to the right experts in our company, and we have a very fast approach to make a decision if we can partner or if it's not a match.
You mentioned like the I wouldn't say traditional way, but the best way, obviously, or the way to enter into the largest amount of patients is through, for example, initially like DIGA. So key for success, obviously, that you get a statutory health reimbursement scheme and being listed in that scheme, so that doctors can prescribe your solution to their patients, and thus it's being paid by the insurance companies. So the hurdle to do so is very, very limited. But those are very complex and they vary by country, and they were initially not made for like startups. So initially it was made for medicine, medicaments, etc. So they're not really tailored to a fast pace of innovation. And you mentioned there is in Germany, it's Stiger. I just did an investment in France in a company. And of course, we ask ourselves the question, how do they get reimbursed? And just to bring in the French perspective a bit, what is interesting there, they chosen a different way than in Germany. In France, obviously, as always, the system is very centralized. So you have the one national health insurance company. Everyone is insured, like 100% of the population is insured. So it's relatively easy to make decisions. And for encouraging innovation, all players within the ecosystem sat together, politics, insurance companies, healthcare players, and defined a framework which gives security over a 5-year horizon and how things are going to be reimbursed. So if you have to pass certain hurdles, you have to show that your solution works. But once you pass them, you have security of a 5-year horizon with a fixed, non-negotiable reimbursement scheme. And for us as an investor, of course, it's super important to know that, because that gives security to how the company can develop. And it's complex enough to build a company, but if the revenues can't flow, then even more so. In Germany, you mentioned we have the DiGA system. It's a bit different. The DiGA system, again, it was meant to foster digital innovation, but you only have 1 year where the companies can fix a price, and then they have to renegotiate with the basically the organization for healthcare insurances. And guess what? Typically, the price, of course, then drops significantly. I mean, there's, of course, a huge difference in bargaining power, sometimes maybe for good reasons. That program had, since the last 6 years, 79 companies, but only 2/3 actually remained into it. So it's very difficult as well to stay there and to prove the need, making, again, the hurdle larger. Yannick, you mentioned you did not choose go through the DiGA, but directly to BARMER. Why? Or what were the difficulties that you wanted to circumvent? And do you plan in the future maybe then to go back through the 100% route, so to speak?
Yeah, and that's right. So Viatolea is not a DiGA. We're a digital medical device, but not certified from the BfArM. This is because when you want to prescribe a DiGA, you need to have like a doctor and the doctor's diagnosis. But the thing is that we want to target people that have chronic stomach pain, that have bloating, that have diarrhea. These are not diseases, these are symptoms. And based on these symptoms, you cannot have that indication, and thus it's not possible to prescribe Viatolea for this. So we're just falling out of that standard scheme. And as well, we do have a human component. So this is dietitians, that help the patients on their pathway. And for DiGA, it is required that the main mode of change is by the digital intervention and not by human contact. So this is like a limitation of that scheme. And at first we were frustrated, but now we see it as a big chance that we can actually develop a product that benefits the patient in the best ways and that integrates best into the healthcare pathway, and we can benefit from a lot of other things. So for example, health insurances and DiGA manufacturers, they're not good friends. There are a lot of strategies within health insurance companies to prevent of exploding costs through DiGAs. And on the other hand, like we do have agreed on reimbursement, and BARMER knows that they can save money with each prescription, so they're happy to announce it to their patients, make them happy, and save sort of money.
So you sort of fall through the grid with DiGA, with a solution, which is a bit strange as well, that if you have a solution that prevents people actually going to see a doctor, you're not gonna get reimbursed, showing how difficult it is. Roland, did the DiGA initiative, from your perspective, bring like a whole new breed of innovative company, or what is your take on that?
I think in 2019, as we started, it was a big chance, and we supported it. We asked very much about the regulations with how to make the cases with the DiGA providers, and how to operate all this with the prescription and Now, a few years later, we see we can't manage it in the best way for the healthcare or for the needs of the patients, and so it's not said if somebody joins a DIGA, it's not said that it will be used, but we pay it for the first year. And I think it's important to make it stable for the DIGA provider. But as you mentioned, after 1 year, sometimes it's very difficult to renegotiate it and to see is it effective for the care or for the healthcare benefits. And so we are thinking it would be better if we are in such concepts like end-to-end user journey passes for the right care situation, and we can consult and help our members to find the right therapies or the right prevention, and I think prevention is a very important thing, and so we think DIGA has to be changed a bit to make more of these objectives to see is it really effective for what it's for the purpose of better care. Yeah. And so I think we have to think to change it and to use the good things of the DIGA idea and to match it with some ideas from selective contracts, and to give the insurance health insurances more possibilities to consult our members and to secure that the right things are done right. So.
I mean, selective contracts, of course, is a great way into the system, but of course has the caveat that, I mean, if you're a doctor and a patient comes in and then you may ask, like, oh, you're a BARMER? Okay, I can subscribe to that. But oh, you're not, sorry. You're just not covered. So and then rolling it out on a national basis obviously becomes much more difficult, because doctors may say, yeah, but if I can't prescribe it to any of my patients, I just can't use it. You mentioned as well that obviously BARMER's using or cooperating with certain companies as well as to build a competitive edge. So to what extent sort of does that hinder to get a broad rollout across Germany? So to what extent would you then cooperate with other insurance companies to say, hey, you have got a great solution here, you should actually talk to them, you should implement them as well, big benefit for patients, and by this sort of partially losing at least your edge?
Yeah. I think it's a competition who is the first mover or has the first great idea at the market or in the own portfolio. But I think we all think in all statutory health insurances the higher objective or the purpose is to make care better in all over the system, and so we share our concepts, and for example in selective contract which was developed and everything's fine and it works and it's in operations, you can scale, then we say here's a template, and every other insurance company can make it the same way because it's not exclusive. Yeah. But our first mover situation will help us to be at the front of the change in the system, and so it's a differentiation in competition.
Well, it's good to see that you're pushing innovation. We're actually already almost out of time. So final question would be, if it was Christmas and you had a wish, Yannick, what would be number one on your wish list as a breakthrough initiative, whatever, to bring forward innovation and make life easier for you as an entrepreneur in health tech?
So I would make a wish to for everyone to be more brave. So especially healthcare providers, healthcare system. So we need to have chances for pilots. Not meaning experiments, but pilots to prove our value, and this in a very easy way and not with so much regulation.
And from your perspective, Roland?
Yeah, I think it's a very cultural thing and not very technical to make the right balance between risk and opportunities and to be brave. I think that's the right wording, and to try it and to give feedback early and not go behind laws and regulation and say that that's all not possible, but to try it and to be honest, if it works, you can scale it, and if not, then you try the next big thing.
Thank you very much. Let's all be brave, and thank you to the attendees. Thank you.
Thank you.